Hey everybody, welcome back to Vetsplanation. So today we're going to be talking about gastrointestinal foreign bodies or GI foreign bodies. They have lots of names, but we're just talking about basically things that dogs and cats have eaten, not things that have gotten stuck because they got stuck between their toes or something like that. This is specifically something that the dog or cat ate that has gotten stuck. So we're going to talk about gastrointestinal foreign bodies or GI foreign bodies. We're going to talk about the symptoms of it, how we diagnose it, treatment options, and what the outcomes of those are. First, to start out, there are lots of names for GI foreign bodies. People call them GI foreign bodies, which just means gastrointestinal. Gastro meaning stomach, and intestinal meaning the stomach. You could have gastric foreign bodies just in the stomach. You can have intestinal foreign bodies just in the small intestines. You can have large intestine foreign bodies just in the large intestines. So you'll hear it called like blockages, small intestinal blockages, gastric blockages, stomach blockages, all of those things. And this also isn't going to include like the other things that happen with the gastrointestinal tract. Like sometimes you can have things like masses and intussusceptions, and I'm going to go into all of those at a different time. Right now, we're just going to be talking about those foreign bodies. What is a GI foreign body? Usually it means that a pet has consumed whatever it is that's causing the problem. And this can be lots of things. This can be toys. It can be bones. It can be things that can potentially break down, but don't. It could be string, corn cobs, hair ties, trash, gorilla glue. Like we've seen tons of different types. So there are ones that are like a solitary thing, like a corn cob that gets stuck. And then there can be things that are really long pieces of things. We have something called a linear foreign body, meaning like string is the most common thing in a cat that gets stuck at the stomach and then comes all the way down the small intestines. And I'll show you a diagram real quick here in a second. But those can be linear foreign bodies. So something that gets stuck somewhere up really high and then leads down all the small intestines. So I just want to go over some anatomy really quickly. So for anybody watching on YouTube, you can follow along. But basically, when the dog eats something, again, I'm a terrible drawer. I'm sorry about this, but I did not go to art school. So when a dog eats something, it's going to go from the mouth into the esophagus. That's going to be this part up here into the stomach. And you can see we have the esophagus goes right directly into the stomach here. And then from the stomach, we have this really small portion that goes from the stomach, this big stomach, into this really small intestines. So the small intestines, they're called small intestines, but they're really long. There's a very long amount of them. So the small intestines come in and they're just all bunched up in the abdomen. They're really hard to see every specific portion of the small intestines. People think on a lot of pictures, our anatomy pictures, it's just like one giant like loop going back and forth, really easy to see each one. And that's really not the case. It's really all bunched up together. And then from the small intestines, it goes out to these thing called the large intestines. So large intestines are a lot thicker. So the small intestines is thinner, like you can see here. And the large intestines is quite a bit thicker. By the time it gets to the large intestines, we come out here, and then that's where they defecate it out if they're going to. But the large intestines, as soon as it gets in here, the chances are it's going to actually pass, which is nice because they're much larger. All right, so that's our quick anatomy here. Let's talk about what some of the clinical signs are. A lot of times, if that foreign body gets stuck up really high, like up in the stomach area, then they're going to be vomiting pretty profusely. These are the guys that are usually sicker because it goes in their esophagus, into their stomach, and just nothing can pass here. So the stomach fills up really full or becomes bloated with just a bunch of liquid that's sitting in there from what the dog's own stomach is like producing. And then they just constantly are vomiting. If it's down below, then sometimes it's more just not wanting to eat, vomiting occasionally. Both of them will likely have diarrhea. And then abdominal pain. So if I push on their belly, they're usually pretty painful depending on where it is and how bad it is. They can become really dehydrated. But the things that you're going to see at home are usually going to start to be vomiting and not wanting to eat. So even diarrhea, people don't even notice sometimes because the dog goes outside and just goes to the bathroom. And some people see them straining and think that they're just constipated. But 90% of the time, that's not constipation. That's usually actually them having diarrhea They're just straining because they have that feeling that they have to go. So they're out there trying to go and only little drops are coming out. So vomiting, not wanting to eat. A lot of people say that they're really lethargic. They just don't really want to do anything. But again, it just depends on where it is and what it is. I've also had puppies just running around, jumping like crazy, and you would never know that they had this intestinal blockage. Right? All right, how do we diagnose it? This one is a little bit hard because it depends on what it is. I'm going to show you an x-ray of my dog later on, but basically, physical exam is usually the first one that we're doing. Typically, we're looking at them. If it's a cat, a lot of times they'll eat string and the string can get stuck underneath their tongue. So you'll see us open their mouth and look under the tongue for a string bit there because it gets anchored under there. And sometimes we don't see it one day, but then they vomit and it gets stuck under the tongue. And then the next day we actually see that string. So always looking under the tongue to see if there's any sort of string that might be attached underneath there. Sometimes we've even found other weird things, like I found a needle that was in a cat's mouth. I've found a grass on pieces of grass in the cat's mouth and stuck in the back as well. So you just never know. But so we're typically doing a physical exam to look under the tongue and also pushing on their bellies. So we're usually like palpating is what that's called, palpating their abdomen. So we can see if we can physically feel the foreign body, which sometimes we can. It depends on how big it is and how big the dog or cat is. If it's a kind of a bit of a rotund patient, then we may not be able to feel that. Versus our skinnier patients, we can actually feel that pretty easy. So we're going to feel for that. And then the next thing we're going to do is do x-rays. X-rays are actually called radiographs. So if you hear somebody saying radiographs, that is the technical name for it. X-ray is just the beam that's coming down. But anyways, we'll ask for x-rays or radiographs. We usually take 3 views, so don't be surprised if they say we wanted to do 3 views, not just 1 view or 2 views or 3 views, because the fact that with only 1 view, we can see possibly that there's a foreign body in there, but we cannot locate where it is. So a lot of times we're doing a second one to locate it, or if we're not sure if it's in the colon versus the small intestines, or if it's in a certain part of the stomach, then we're going to take 3 views. So it's very typical to take 3 views because that's the way that we are able to see the whole animal. We see them on their left side, we see them on their back, and then we see them on their right side. So taking those x-rays, sometimes we can see things really easily. Things like metal, rocks, those are really easy to see. They show up really well. I'm going to show you again later on an x-ray of my dog. But you can see them very well. Other things we can't see as well. Sometimes there are cloth or the stuffing from the bed that they pull out and eat. Those are really hard to see on an x-ray. It looks a lot like their regular intestines on an x-ray, and that makes it very difficult to see. So sometimes we're also looking for gas patterns. So we're looking to see, is there a large amount of gas in one area and then just stops? Or we're seeing if an area of the small intestine becomes really dilated and then another area is really small. Because that would tell me that there's a lot of fluid backing up behind that object, and then all the rest of it is clear. We're also sometimes going to be asking to do other types of x-rays. So you can do something called a contrast x-ray. It's basically where we put in a dye, we'll have the animal drink the dye. So having the dog or cat drink it, they almost always hate it, and I feel always really bad about it. But that's a good way for us to be able to see where that dye is going. The 2 types of dye are usually called barium or iohexol, or radiographin is the other name for that. But it's basically we have them drink this, and then we take x-rays, a series of x-rays. So it's usually, it's a pretty long series, but they take a series of x-rays to see like where all of that stuff is going. So we can see them swallowing it. We can see them going into the stomach. It coats the stomach, and then it goes down all throughout the small intestines. And it highlights it so we can see if something is like going around something else or if it's getting stuck in one place. Because the other problem with foreign bodies is sometimes you can have a partial foreign body. On an x-ray, I might be able to see this really big dilation of small intestines and then nothing and see a nice foreign body. But if you have a partial obstruction, that means that only if you have your tube of your intestines, it's not covering the whole tube and not making anything, not allowing anything to pass. It's only covering part of it. So some stuff can still pass through there. And again, that makes it like really difficult because if we can't see the foreign body and we can't see these gas patterns, then sometimes we just don't know that it's there. Other things that we can use for trying to diagnose this is ultrasound. Not everybody's going to have an ultrasound, but sometimes using an ultrasound can help. And we're looking for a couple of things. We're looking to see if there's fluid in the abdomen or in the belly. Because if there's fluid, that's not a good thing. That usually means that something the intestines or the stomach has opened up, called a perforation. We're also looking to see if we have really dilated small intestines, like you see just all this fluid going in there and just stopping, or the fluid just sits there going back and forth because it has nowhere else to go. And sometimes you can see that actual object as well. So usually using ultrasound can help with that too. And then lastly, you can use a CT. So CAT scan, let's say the name for that. But a CT scan is basically where you're like taking multiple images of the patient in order to be able to see all the different parts. And sometimes you can see it on a CT as well. That's definitely the more expensive route. So a lot of times you're doing an exam first, and X-rays, and an ultrasound, and then if you can't find it, then CT is probably going to be your next best option. All right. Some of the things that you can also do with X-rays, we're going to talk about again. What are we looking at for X-rays? That's the most common thing that we're going to use. Like I said, we're going to look for things that are really easy to see: metal, rocks, some foreign bodies we can see well, but again, a lot of the cloth ones get really difficult to see. Looking for those gas patterns, looking to see if anything's really dilated. And then if we're not sure if this is in, let's say, the small intestines or the stomach versus in the large intestines, again, the large intestines, if it's in there, it's going to move. We don't have to worry about doing surgery. It's going to move. 100% of the time, it will move. Sometimes we'll do something called a pneumocologram, meaning pneumo means air, and then colon, so colo, and then gram is just like taking a sample of. So we'll put air like up the butt, actually. So we're putting air up into the large intestines so that we can actually make this as like a contrast, so we can see the difference between air that's in the colon and an object that's in the colon. Because if we see a rock and we're like, I'm not really sure if this rock is in the small intestines or if this rock is in the colon, because they really overlap, then we can do that pneumocologram so that we can see if that rock is in the colon. Because if so, we don't need to do we don't need to do surgery. It's going to find, again, most likely it's going to pass. If it got through all the small intestines that are really thin and got to the large intestines, then it's most likely going to pass. All right, we're also looking to see like how big this item is. So is this like a really small little metal thing? It's probably going to pass. We don't usually have to do anything about that. Or are these really large things that even if we put them on fluids and stuff, it's not going to pass? So we're looking to see like how big those items are. And then also on X-ray, you can see fluid when there's quite a bit of it. So we're also, again, looking to make sure that there's not fluid because we worry about a perforation or the intestines opening up from whatever the object is. And then sometimes we also have to submit this to a radiologist. A radiologist is usually a board-certified veterinarian, so somebody who has gone to extra schooling to be able to learn how to read X-rays and ultrasound better with better tools than sometimes we can. So they're looking for lots of different things. This is like when you get your X-rays at your own human health facility. They don't actually read them at that facility. They send them to a radiologist, or the radiologist is on staff so that they can read those X-rays. And so that's somebody who, like I said, that's their specialty. That is all that they do, is they read X-rays all day, every day. So those are the people that sometimes we have to send them to because we're just not sure. And we don't want to go into surgery or make the dog or cat worse by doing something that we didn't need to do in the first place. So a lot of times we'll talk about sending it out to a radiologist so they can confirm if there is a foreign body or if it's something that may pass or if they see something else in there that we just don't. I know a lot of people always are like, you take the X-rays, you should be able to read them. We can read them, but sometimes there's just really intricate details that we may not be able to see that the radiologist will see. All right, what about ultrasound? What are we looking for on ultrasound? Like I said, we're looking for, can we see an object? So can we see the actual foreign body itself? Can we see free fluid or fluid in the abdomen, telling us that means that there's probably a perforation somewhere, which means we need to get into surgery right away. Are we actually seeing plication? So you can have those linear foreign bodies that I was talking about with cats, the string that goes from the tongue all the way through the stomach into the small intestines, you can see the small intestines. What they want to do is they want to move things by like making this almost like massaging motion. They're just moving things along. And when they move, all of that, and it moves along a string, all of that stuff just like plicates. So it almost looks like an accordion, and it all becomes coiled in on itself. It's just like a ball of small intestines rather than it's freely floating small intestines that are usually in there. We can usually see that on our ultrasound. So we're looking for that plication on ultrasound. It is something you can see on X-ray, but it's a little bit harder. So usually ultrasound is the best way to see that. Now, what about our most common things that we see? The most common things that we're going to see in our patients is usually going to be foreign bodies in the small intestines. There's multiple parts of the small intestines, but the middle portion of the small intestines is usually the most common place that we see them. You can also see them in the stomach as well, pretty frequently. And then in the colon, again, like where they're going to poop it out anyways, it's less likely because they've already passed all the symptoms. So usually it's not as likely we're going to see them there. So usually small intestines and in the stomach are the most likely to cause all of those symptoms. Now, what are we going to do about it? So we found the foreign body, let's say on X-ray. Now, what are we going to do? The next step is try to decide what the best treatment option is going to be. And sometimes we'll talk about many treatment options. I usually will talk about 2 or 3 treatment options, depending on what the foreign body is, how long it's been there, and what's going to be the best thing for that pet. First thing is deciding where is it and what is the size. If we're like, hey, this is really tiny, that's probably going to pass, then we usually just talk about doing outpatient treatment. But I will say there are going to be some tiny objects that we're going to say, it doesn't matter if this will pass, we need to go into surgery right now. So some of those can be things that are going to cause zinc or lead toxicity. So pennies can do this. And pennies are real tiny. You would think that'd be able to pass just fine. But as it's in that stomach, it's breaking down all of those chemicals and it's causing them to become really sick. And I'll do that toxicity later on. But that can be a really big deal. So we want to make sure that we get those out right away if that's the case. Sometimes for certain things, like if they're small and in the stomach, we can actually make them vomit. Things like socks, and we know that they've ingested it very recently. For me, I usually will make them vomit within 3 hours of them eating it, because otherwise you have the stomach becomes the small intestines, right? After about a couple hours, all the stuff that's in the stomach is going to move into the small intestines. After it passes the stomach, we cannot make them vomit it out. There's a little sphincter that's right here, and nothing in that small intestines is going to come out. Only the things that are in the stomach. And even then, we usually can only make them vomit about 75% of what's in the stomach. So it's not always something that they're going to get out. And if they have an empty stomach, a lot of times we'll feed them first and then make them vomit so that they have something else to come up as well. But it also depends on what kind of objects those are. If it's something like a skewer, we don't want to make them vomit, because if their stomach contracts, then that skewer is just going to get pushed through the stomach, not actually up into the esophagus like we would like them to. If it's going to be something that's really sharp, like bones, again, we're not going to make them vomit because it's going to be really sharp as it's coming up that esophagus. The stomach is really big. The esophagus is much smaller. And if it's going to come up the esophagus, we don't want it to create lacerations or cuts in the esophagus. That would be pretty bad. Only certain things are we going to make them vomit for. Let's talk about the pros and cons of making them vomit as well. Like I said, it cannot be done for anything sharp, anything that we risk perforation for. And then it can also cause trauma to the small intestines if it's too late. So if the stomach is here, stomach is the first thing, and then we go into our small intestines. If, let's say you have a sock. So that sock, if part of it is in the stomach and part of it is in the small intestines, and we have tried to make them vomit, we can actually rip this little sphincter that's between the stomach and the small intestines. And we don't want to do that either. Even though we got the sock up, now we still have to go into surgery, and that can be a really difficult surgery to do. So it depends on how long ago it's been that they've eaten it, whether we can do that again. Usually those are the biggest risks. The pros are if you're able to get it out with the making them vomit, or inducing emesis is what it's called. Then that's great. We've saved money. We've saved time for the recovery. We've saved the pet from having to go under sedation or also under surgery. So if we can do it that way, we always try to first. But sometimes it's not going to happen that way. So depending on, again, where it is, what it is, it might be just talking about doing fluids. So we give them either fluids under the skin called subcu fluids or subcutaneous fluids, or we'll give them fluid through the IV. If they're in the IV, usually they're staying in the hospital. So we're putting it directly into their vein. So that way we can give them more fluids. We can only give them so much fluids under the skin or subcu. So ideally that's not the best way, but fluids IV is usually better. That way we can rehydrate their intestines, because sometimes their intestines are just like stuck, clinched, because it's really painful and they're just really dehydrated. So sometimes when we give them fluids, it opens up those small intestines and allows that to be able to move through. Giving them fluids, sometimes we give them pain medication, and then rechecking those x-rays. Rechecking the x-rays is usually between about 8 hours to 12 hours after those x-rays, those initial x-rays are taken, because we want to see, did that pass or did it move at all? If it has not moved at all, then we know we have to go to surgery, versus if it's moved even just a little bit. And then we're going to talk about, are we going to wait and see how this turns out, or are we going to just go to surgery? Because a lot of times after it's gone through the small intestines, it should be in the colon between that 8 hours, 8 to 12 hour window, if it's going to pass. So some of the cons about doing just fluids and rechecking x-rays is, one, it may not pass. So you've had them hospitalized for that extra 8 to 12 hours and it still didn't pass. It could be that in that period of time, that 8 to 12 hours is a long time. It could perforate through that. So it can actually cause a hole in the small intestines. And now we have fluid leaking out in the small intestines. A lot of times when we're watching them, they've gotten a lot sicker in those cases. So a lot of times we know that there's probably a bigger problem, but it is a possibility. And also you still may not see it because it still be a partial obstruction when that's not fully making it to where things cannot pass, that things can potentially still pass there. So we may not see it that way. Some of the pros are that you save money, because if you don't have to go to surgery, usually it's less expensive to have them on fluids and rechecking x-rays than it is to go to surgery. And it's less invasive. So it's not going to be going into a surgery for the pet if they don't need it. Just like weigh these things, like what's going to be the better option for them. And then endoscopy is another one that I get a lot of questions about. Endoscopy is where you stick a camera down their mouth into their esophagus. The camera's going down in the esophagus into the stomach. So again, this is another one that we cannot pass the stomach because there's that little sphincter that's there. So we can only go into the stomach here. Very rarely, like usually internists can go into the very first part of the small intestines, but that's it, like a very tiny amount. They can't go through all the small intestines. So if it's in the stomach and is something that you can get out very easily, then great. That's a great option. But some of the things to know are we only have little tiny little pinchers to be able to get things out. Sometimes they'll use other tools, baskets and things to try to get things out. But if it's a really large object, like a really big rock, we're not going to get that out with endoscopy. It's just not going to happen. Versus if this is something really small or something that can easily get out, let's say a baby sock we can grab easily and be able to pull out. There's always going to be limitations to this as well, though. If the stomach is really full of fluid, then sometimes it's really difficult to see those things, and we're just not going to be able to get it out with an endoscopy because we just can't see it if they're small and there's just tons of fluid in there. Or it may be that even though it was in the stomach, by the time we've gotten into that procedure, maybe it's already moved into the small intestines. So again, we may not be able to see those things, but some of the pros of doing endoscopy are that it's less invasive, so we don't have to cut into the patient. So it's not going to be as long of a healing time. It's not going to be as long in the hospital as well. It could potentially cost less. It really just depends on the facility. And then they have like less healing time as well. Versus the cons of doing endoscopy are going to be that we may not be able to get it out. So we may do endoscopy and still not be able to get it out, and they still have to go to surgery. So it's going to be more time under anesthesia, because if we had just gone to surgery first, then it's going to be less time potentially than it was if we had just done surgery versus doing endoscopy and then surgery. Other things is it may get stuck depending on the object. So sometimes you could try to pull it out from the stomach, but remember that our esophagus, our little food pipe, is definitely smaller than our stomach. So it could potentially get stuck in that esophagus, and then we have to push it back in, and then now upset all the esophagus that's there, we make little scarring on it. So again, not ideal. And then you have the risks of anesthesia. No matter what thing you do under anesthesia, there's always going to be a risk, no matter how healthy the patient was before anesthesia, and no matter how healthy the patient is while we're doing the procedure. You also cannot see the entire intestines. Like I said, you can only go into the stomach. I cannot see all the rest of the stuff in the intestines. So yes, there may have been a rock in the stomach, but maybe there was a baby sock in the small intestines. I'm not going to see that. So if that's the case, maybe the rock wasn't the problem at all. Maybe it was that sock, and we've taken out the rock, and that was it. So we can't see anything in the small intestines. You could also have things like masses in the small intestines and other weird deformities in the small intestines. And again, we can't see that when we're doing endoscopy. And then also, one of the nice things I forgot to mention before was that when they wake up, usually they're able to go home pretty quickly. Again, they don't have to be hospitalized for that. The treatment we usually do is going to be surgery. So surgery is essentially where we make an incision just right over where their umbilicus is. So on their belly, just in the middle of their belly is usually where we make the incision. So a lot of people think of spays for their pets, and you see this tiny incision for them, but this is actually going to be a much larger incision, but in the same area. But that way we're able to see all of the stomach and the small intestines. Usually small incisions are not as good for those things. So we want to take out all the stomach and the small intestines so we can be able to look at everything. Depending on what procedure we have to do, depends on what we're doing. So there's typically a couple different types. If the object is in the stomach, we're doing something called a gastrotomy. That just means we're going into the stomach, we make an incision into the stomach, and we remove the object, and then we suture that stomach back up. This is usually the best case because they heal really well in the stomach. The stomach is really forgiving. It can stretch really, like a really big amount. So the objects in the stomach usually do really well. But it might be in the small intestines. So if it's in the small intestines and we just have to make one little incision in the small intestines and remove it, let's say again a rock, then it's called an enterotomy. It just means going into the intestines, make an incision, pull it out, suture it back up. Let's say we get in there and we see that part where, let's say that rock or that sock or something in the small intestines is really black and it's dead, or it has a hole in it called a perforation. That's not good. That usually means that intestines will die off and will open up. And instead of allowing it to do that, we just want to take it out. So it's called an RNA, or a resection and anastomosis, because you're resecting it, you're taking a piece out. And anastomosis is going to be bringing those two pieces back together. The two healthy pieces are touching, and that bad piece is now gone. That always has risks as well. So some of these pros and cons of this, the risks of the RNA, or resection and anastomosis, is that when we put those two pieces back together, the body may not realize that it's the same thing and it's from the same body. And it may actually dehiss or come apart. And if that's the case, that's not a good prognosis either, because all that fluid from inside the stomach and the small intestines is now going to leak into the abdomen and makes them really sick. This usually happens about 3 to 5 days after surgery, but it can still happen immediately afterwards and up to 7 days afterwards. But it's basically where they don't make a scar that's like going to keep all of this stuff together. And it's not usually because of the way that the surgery was done or the way that the suture pattern was or anything. It's just the dog or cat's own body not allowing it to heal correctly. So some of the other cons of surgery are going to be like, again, it's more invasive. If we can take it out a different way, that would be great. It can be costly because we're doing a full surgery. It's not just like a minor little procedure. And then they usually do need to stay in the hospital afterwards because we want to make sure they're on adequate pain control and ideally that they're eating before they go home. Cats, I'm always like, if they're just okay on pain control, a lot of times cats won't eat in the hospital, which I'm okay with. And I'll usually send them home. But for dogs, I usually like them eating So it might mean having the owner come to be able to see if they can eat versus just giving them appetite stimulants as well before they go home. And some dogs are just really nervous and they're just not going to eat in the hospital. So a lot of times I just send them home with their parents. And then the other con can be you can have a negative exploratory, meaning that we may say that, yes, we need to go in there. The radiologist says, yes, we need to go in there. It looks like there's an object that's in there. And we get in there and there's no object. It could just be that they had something called ileus, meaning that their intestines just like stopped moving in one spot. So it looked like all of those other patterns that we talked about. The small intestines were really dilated with fluid. There was gas that was stopped at one area. So it might look like we need to go in there and we really don't. That's not something we have as much now. It was something that we had quite a lot before because we just didn't have all the technology to be able to look for those things then. Now it's not as common that we see that. Mostly we see those with our ones that are partial foreign bodies that were like, it really seems like it's a foreign body, like they're vomiting continuously. Like we say that we think we should go in and do an abdominal exploratory, meaning we go in, we don't know if there's an object that's in there, but we're going in there to see. And if we don't see anything, it's not actually a partial obstruction, then we have a negative exploratory, meaning we did not find anything. And even in those cases, it's still good information. We still know that there's not an object in there. A lot of times they'll get biopsies if that's the case. So taking samples of the tissue to see like, why did we have this in the first place? Because sometimes you'll have weird things like parasites that are in there, or you can have weird diseases, cancers and stuff that are in there that cause that. So it still gives us good information, but it was definitely a more invasive way to get that information. All right, so let's talk about some of our complications of each of these. So some of the complications of inducing emesis or making them vomit, that can be things like aspiration pneumonia. If we make them vomit and then they inhale some of that, then they can inhale it into their lungs, and all that bacteria that they just inhaled can create a pneumonia. It's, again, not a very common one, but still something that can potentially happen. It could also be that we tried to induce emesis. We try to make them vomit, and then it gets stuck in the esophagus, and we have to go in and quickly and push it back down into the stomach or grab it with endoscopy if that's a possibility. With fluids and rechecking x-rays, our big things we worry about are going to be that those intestines can perforate in that period of time, so it can open up. And then with endoscopy, sometimes you can get scarring, like strictures. It's like literally like just you have your nice little esophagus and it just makes this scar, makes it smaller if there's something that's stuck in that area. That's not necessarily due to the endoscopy itself. Those cameras are pretty small, but it's actually due to pulling it out and then it just scraping along the esophagus. And then for surgery, our big things are infection. A lot of times they're giving antibiotics beforehand so that we know that we're not going to have some sort of infection. And it's usually just a couple of doses before and afterwards to make sure that we reduce the risk of infections. You can have dehiscence. So again, that's like where we have, if we did an RNA, where you take out that bad section, put two pieces back together, that can open up. That's called a dehiscence. That can even happen in an anerotomy, where we just make one little incision in the intestines and then close it back up. It can open back up, especially if there's cancerous things that are there as well. You might have to go back into surgery. So sometimes that area where you did surgery can create adhesions. This isn't something as big in veterinary medicine as it is in human medicine, but it is still a really good possibility. I've had it on multiple dogs so far. I've had to go back in on other people's surgeries because there was an adhesion that was there. It is literally nothing that the surgeon has done. It was actually just that's the way that the body healed. And adhesions are like the scarring. So instead of you having these really nice twists and turns in your stomach and your small intestines, in the small intestines, it will create a hairpin turn and nothing can really pass in that area because it's too tight. It's become too small and no food can pass through there. No objects can pass through there. And a lot of these dogs and cats that eat objects, they're likely going to eat another object. If there's adhesions that are in there, they're probably not going to pass. And then infection, that's another big one. Like I said, even not just the infection from the incision into the intestines or into the stomach itself, but actually infection on the outside of the body, on the skin. And 90% of the time, that infection is because the pet parent did not keep their restraint collar or their e-collar or cone of shame, whatever you want to call it, on. And that pet was able to lick at it. Dogs are really smart and cats are really smart, and people don't really give them as much credit for that. People are always like, I'm with them all day, and literally they don't lick at it. But you have to sleep sometimes, and you have to go to the bathroom sometimes. And that's exactly the time that they're going to start licking at it, because they know that if they lick at it in front of you, you're going to get angry at them. But if they lick it when you're not around, then they can get away with it. And when we do their surgery, we usually shave their belly. And as that hair grows back in, it's itchy. And so they're going to lick at it. Even if that incision isn't bothering them, the itchiness of the hair growing back in is going to bother them. So they will lick at it. Keep those e-collars on so that we don't have any of those infections on the outside. Now let's talk about our outcomes for this. In most cases, they do really well. Like I'd say a good 85 to 90% of my cases that I have to do surgery on or endoscopy on or just make them vomit, they do great. No problems. They go home. No issues. But it depends on how complicated this is. If it had perforations, so if that intestines opens up and all that fluid is spilling out into the belly, there's going to be more complications to that. We have to put in drains to try to get all that fluid out and to make sure that there's no bacteria that's still in there. You could have more risks of adhesions or that scarring in between each one of the small intestines. You could have other problems that it creates inside the belly, so like pancreatitis, which I've covered before. But the pancreas sits right next to the stomach, right next to the small intestines, the beginning part. And if you have pancreatitis, that makes them really ill as well. They don't want to eat. So you can definitely have like lots of other complications from that. And those other complicating factors are going to make that not as good of a prognosis. It's going to be more concerning that they may not leave the hospital if that's the case. Or if they're super, super sick, even going into surgery, we do everything we can to try to help stabilize them beforehand. Most cases, I'm not going into surgery immediately for these guys. A lot of times I'm putting them on fluids first so that I know that they're hydrated enough to go into surgery. And if they're still declining, even though I'm trying to help stabilize them, then sometimes we just have to make the decision to go in no matter what. A lot of those that have perforations, we try to go in pretty quickly. And again, I'm trying to help stabilize them in surgery while we're also having to deal with the surgery. So those can be really complicating factors and not always the best prognosis. I will also say the other bad prognosis can be from those patients that do eat objects over and over again. The more times we have to do that surgery, the worse it is for the intestines, the more likely they're going to get adhesions, the more likely they're going to need resections. And we can only take out so much intestines. It gets to a point where we've taken out so much intestines that it causes something called short bowel syndrome, meaning that they cannot absorb enough of their nutrients and they're just constantly having diarrhea all the time. They get really skinny. It's not good for the pet. And so we ideally don't want to have to take out more than what's needed. All right. Let's talk lastly about some of the most common questions that I get. One of the most common question I get is, can I just give my dog or cat mineral oil like I do a horse? So it's usually not a very good idea. It doesn't really help them pass it more. People think that just lubricates it so that way things can pass. That doesn't really happen for our dogs and cats. I'm not even sure if that really happens for horses. That's not my realm, but giving them that mineral oil is actually going to make things worse, especially if they vomit and inhale it. That's mineral oil just gets stuck in their lungs, and that can be detrimental. Because especially they do not like the taste of that, and a lot of times they will vomit it right back up. We need to get them medication to help stop their vomiting, not making them vomit more. And so far, I've not heard anybody that's been successful with doing the mineral oil. I know it was something that they used to do a long time ago, but we stopped that for a reason because it just didn't work very well. The next common question I get is, how long can I wait to have the surgery done? So if I diagnose it at night, because that's when I'm there, can I wait till the morning for the surgery to be done? So there are a couple of things. Yes, you could potentially wait for the surgery depending on where it is, what the circumstances are. Let's say it's in the stomach and it's something that's not like fully blocking them. Can you wait till the morning to see your regular vet? Sure. We'll just give them medication to make them stop vomiting, giving them fluids under the skin, and then you go to your regular vet in the morning, if they'll do it. That's also the other big thing is sometimes they will not do it because they're already booked up on their day. And they're like, you're just going to have to go to an emergency hospital to do that. So then you're right back where you started in the first place. There's also the thoughts of if this is something that is lower down. If it's lower down and they're not vomiting quite as frequently, they're not really like as sick, then sure, again, we can give medications to support them. And then you can go to your regular vet in the morning. But let's say this is something higher up in the small intestines and they're really sick. They're just vomiting continuously. And that's not a good sign. We need to do something sooner than just like waiting till the morning because the chances of them perforating or opening up those intestines are much higher then. And we need to be able to get in there before that happens. Because you may think that you're going to save money by going to your regular vet, but in the end, it actually ends up costing more because maybe it was just a really simple procedure that night, but in the morning, it becomes a much more complicated procedure because that intestines has opened up. And now we have many more problems that we have to deal with. It might be just a one-day hospitalization at the ER, but it might be a multiple-day hospitalization if we have to do it at the regular vet. And most regular vets can handle all of these things, so it's not that I'm worried that they're not going to be able to do them. It's mostly just the timing of things. How sick is that pet? And then the last thing I think I get the most is what do we do if we can't get funds for surgery? Surgery is not cheap, right? Surgery is an expensive thing. And most of the time, you're going to have to pay for these surgeries before we do it. Because most veterinarians do not have payment plans through that vet. It's usually through third-party companies. So we usually like talking about doing third-party companies, like going through them. So the two biggest ones are Care Credit. So Care Credit usually uses I think they go off your credit and then they give you a credit card that you can use for humans and animals for health things. So you can apply for that online. You can do Scratch Pay. So Scratch Pay, not everybody takes. You just have to try to make sure that you've gone to the hospital that does take it. But Scratch Pay is similar to a Care Credit, but it's actually a loan. So it's a one-time loan that you apply for specifically for animal health so that you can get a loan that you pay back. So you're still making payments, but you're paying it back to that third party, not specifically to the veterinarian. There's also credit cards. Like a lot of people that I've had have just taken out a new credit card, like literally applied online at night and then just got a new credit card and then use that credit card number immediately. That's another option. Starting GoFundMe things. The hardest part about that is you do have to have the finances beforehand. So GoFundMe, usually you can't get enough just in that time period of an hour or 2 hours before we do surgery, right? But a lot of people I've had do put up a GoFundMe and then they've had like other people help with their loans. They'll have their friends or their family members help them with giving them money to try to help with the procedure. And then they've used that GoFundMe account to be able to pay the rest of it or to pay their family members or whomever back. What you can do are looking for funding, essentially. There are lots of places that do give funding. The Humane Society is usually one of them. So I always tell people to check the Humane Society. And remember to do this all during the day. If you know you're going to be in the vet because you're concerned that they might have eaten a foreign body, try to do all this during the day because at night they're closed. At 6 p.m., no, we can't get a hold of anybody at that point. But during the day, if you call or go online to the Humane Society, they'll usually have something to fill out or they can talk to you about it. The Humane Society wants to keep their pets with their families. So they want to try to help by giving some amount of money. It's usually not going to be the whole amount for like the surgery. It's usually going to be a couple $100, but it's still something to try to help with that. There's also lots of other rescues and stuff that will help with it as well. Because again, everybody wants to keep them with your family. They really don't want this to be that they have to get relinquished or anything. But let's say we can't get the funding for it. You apply for Care Credit, but you can't pay that back. At that situation, we don't want it to be that you as a parent, you as the pet parent, can't afford rent or food or your car or anything. So there are other options. There are also things like relinquishing them to the Humane Society so that they can hopefully get the services that they need. Or even if they're really bad, like a lot of times I'll talk to people about when they're really sick and it's going to be really expensive and we're not sure that they're going to come out of this, unfortunately, considering humane euthanasia, because we don't want them to suffer and I don't want to send them home because I know that they're not going to pass it. So that's an option as well. All right, that was a lot on our surgery stuff and just GI foreign bodies in general. If you have questions for me, again, like always, you can email me. I'm always happy to answer those. And then I'm going to do a screen share really quickly so anybody who is on our YouTube or wherever can look at this. So I just want to show you really quickly what my dog looked like. So this is my little lab puppy when she was little. This was like 6 years ago, that she ate rocks. So I was talking about what x-rays look like on here, right? Our x-rays, again, we have to do 3 views. I'm just going to do the one where she's on her back because I think this is the easiest one to see things. Here are rocks right here, these really bright things here. Here is things like her diaphragm is up here, her chest would be way up there. Her stomach kind of sits in this area right here. The stomach is like in this generalized area. And then all of her small intestines are all throughout here. And then her colon is actually coming up this way and around here to here. That's all colon right there. When we take those x-rays, we're trying to figure out where is all this stuff, right? All the small intestines are sitting all over the colon here. So it's really difficult to see whether it's in the colon or not. Her stomach is again sitting right in here. And then the stomach then becomes the small intestines. So stomach becomes the small intestines, and we just have to see if all this stuff can pass through. So for her, we did not want to make her vomit necessarily, because you can see, because she had this really sharp angle on her rock there. So ideally, I didn't want to make her vomit. And she had quite a few rocks, so I wasn't really sure if she could vomit all of this up. But we just gave her fluids and tried to see if it would pass, and they did. It did pass, which is great. But we just never know if they're going to pass or not. All right. So, real quick, that's what I was saying about our foreign bodies. Sometimes they're really easy to see, and sometimes they just all look like the small intestines, and we can't see anything. You saw like how jumbled up all of that stuff looks. It's almost impossible to see them sometimes. All right, now I'm going to do my fun animal fact really quickly. So, animal fact, we're going to talk about pistol shrimps. It's also called a snapping shrimp. These are really cool shrimp. It just amazes me, all these animals. But they basically have a really cool superpower. So bear with me for a second. So these shrimp are really tiny. They're usually about 2 centimeters long. And they have 2 different sized claws. So you'll actually see a lot of shrimp that have a small claw and a big claw. But this one has a really big claw. And when it senses that there's some sort of prey nearby, it'll open the claw just a little bit so that water can get into there. And then it like into this little crook of the claw. And then it quickly snaps it down. And when it does that, there's this pressure from a little plunger that's inside that big claw. Now, when they snap it, it forces water out of that claw, but it also creates these really intense bubbles. So these bubbles can actually go out of that claw at speeds of 60 miles per hour. That's as fast as going out of a claw to the freeway, essentially freeway speed. And that can kill or just even stun any of its prey, so it can quickly go over and eat it then. But these bubbles also, when they pop, they make really loud snapping sounds, which is why these are like pistol shrimp, because they sound if they're pulling out a pistol and shooting. And they usually do a couple of them, so it literally sounds like a pistol going off. And then there are lots of different varieties. Oh, sorry, the other thing I meant to mention is that if you put your ears under the water or you go down into the water, you can actually they're so loud that you can hear those pistol shrimp going from, even if you're not next to them. Like you'd think this little tiny thing, they should have to be next to the shrimp to be able to hear it. But you could be above the water or above them in the water quite a bit and still be able to hear it. So there are lots of different varieties of these. So I'm going to talk about the one that I think is the coolest. It's the Synalpheus pinkfloideus. It is named after Pink Floyd. Their bubbles can reach 210 decibels. So it is so loud that it is louder than a gunshot. So a gunshot is about 140 to 175 decibels. These are really loud. Also super crazy. So they can use that for when there are other predators nearby, or if they are they want the prey and they don't want the other shrimp that are around to get the prey. They can use that to be able to make those other predators and other competitors go away. It just scares them. They also use their large claw for other things. The other thing is that large claw, the larger the claw, the more likely they are to get a mate. The female pistol shrimp prefer them to have a very large claw because they're more likely to be able to protect them, right? So super interesting. There's like lots of other interesting facts about them, but I thought that was a really cool one. All right, guys, as always, if you have any questions, you can email me, shugs@vetsplanationpodcast.com. So that's SUGS@vetsplanationpodcast.com. You can find me on social media. You can message me, and I'm always happy to answer questions. And again, I'm always happy to do a topic if you have a question about a specific topic. All right, thank you, guys.